Your hip flexors can be a major cause of back pain and sciatica. And so in this video, I'm going to show you 4 different ways to stretch your hip flexors, as well as to know when you need to stretch your hip flexors at all, and also which version of the stretch may be best for your particular problem. So number 1, the way that you know if you want to stretch your hip flexors is by a very simple test. That you don't want to stretch a muscle just because it hurts. You only want to stretch it if it's stiff or if it's short. So to test the length of the muscle, to test the length of your hip flexors, there's a really simple test where you just lay on the side of a bed and you lay close to the edge with one knee pulled up to your chest and then let the other one drop off the side of your bed, keeping your back flat on the mattress. Now, your legs should ideally fall all the way down to the edge of the bed with your knee bent pretty close to 90 degrees. If your leg is hanging out like this and it doesn't fall quite all the way down to the mattress, then chances are it's a little bit stiff and that you might need to stretch. Now, the first variation of the stretch is just like this test. If you find that you do have some stiffness, you can stretch it just by letting your leg drop off the edge of the bed and hang there for about a minute or so. The important part of this is keeping your back all the way flat up against the mattress, and you do that by keeping this knee pulled up tight against your chest. Now, that variation of the stretch is best if you can't kneel, because one variation that I'm going to show you, you do actually have to kneel for it. And if you have knee pain or some other problem that keeps you from kneeling, that's a better version of the stretch for you. The other advantage of that version that I just showed you is that it keeps your back in a flat position. With that knee all the way up to your chest, it keeps your back flat on the bed and won't cause any other problems in your back. Now, if you can kneel, this version is one that's easier to do. You can do it kneeling on the floor. You can also do it kneeling on the bed. For the purpose of this video, I'm going to show it kneeling on the bed just to make it a little bit easier for you to see. But you can do it kneeling on the floor or kneeling on a pillow as well if you need a little bit of padding underneath your knee. So to do that one, you're going to kneel again with the leg that you want to stretch down flat on the bed like this. You're going to put the other knee up like this, and that essentially brings the knee up to your chest, just kind of like you did with the stretch. Now, if you look up hip flexor stretches on Google, you may see a stretch where people go like this. But you'll see there's a lot of arch in your back, which isn't good. You want to keep your back nice and flat. So the best way to do that is to start back, get your back in a flat position like this, and then roll your pelvis underneath of you like that. So you're keeping your back in a flat position. You don't want to let it arch like that. And you'll notice that if you just roll your pelvis underneath of you, you don't have to go very far before you start to feel a stretch in the front of your thigh and in the front of your hip flexors. Now, one big advantage to this one is, one, you don't have to lay down on a bed. You can do it just about anywhere if you can kneel on the floor. The other advantage is that it stretches both the hip flexors that come from your back down to your hip, as well as a second set of hip flexors called your rectus femoris, which runs from your hip and goes actually across the knee. So this helps stretch both the iliopsoas muscles, which just run right through here, as well as the rectus femoris, which is one of your quadricep muscles and also a hip flexor. Now, the other options are ones that are good for people who have trouble kneeling and who just really won't take the time to lay down to do the stretch, or who have back pain when they lay down flat on their back because they can't keep that knee all the way up to their chest. So these next 2 versions I'm going to show you are actually standing. The disadvantage of these next 2 versions is that it doesn't stretch the rectus femoris. It only stretches the part that doesn't cross your knee. So to do that, I'm going to come back this way. The first version is putting your foot up on a chair. So again, it's kind of like that lunging stretch that we just did, where this knee up on the chair is helping to keep your back flat, and then you're going to lean forward and roll your pelvis under just like we did before, which will stretch out the front of the hip flexor muscles here. Now, again, the advantage of this is you don't have to kneel down. You don't need to lay down. All you need is a chair or a stool or something that you can put your foot up on. But the disadvantage is because this knee isn't bent, you only stretch the iliopsoas muscles, which is right here. You don't stretch the rectus femoris, which is the other hip flexor, and runs all the way down past your knee. So there's trade-offs with each version. Now, the final version is very similar to the one that we just did, but it's without a chair. So you just stand kind of like you're walking and roll your pelvis underneath of you. And that's the stretch essentially, is you just get your spine in a good position, roll the pelvis underneath, and you should feel a stretch right there. This one is particularly good if you have especially tight hip flexors. If you tend to get back pain or sciatica when walking, this is perfect for you because this is essentially the functional motion that you use each time you take a step. Now, the disadvantage of this one is that it is a little bit harder to do because that knee's not up on the chair or pulled up against your chest. There is more of a tendency to arch your back like that, so you really have to be mindful of tightening your stomach muscles, squeezing your buttock or glute muscles, and rolling your pelvis underneath, and you'll feel the stretch right in the front of your hip flexors. Also, if you don't have especially tight hip flexors, if they're just a little bit tight, you may not feel this stretch as well. But those are the 4 different versions of the hip flexor stretches, as well as the reasons that you might want to do them or might not want to do a particular variety. If you found this video helpful, click the subscribe button at the bottom of this video and you'll get notified of our future videos. Thanks and have a great day.